Today we're going to show you how to use a metered dose inhaler. First, remove the cap and hold inhaler upright. Now shake the inhaler. Tilt head back slightly and breathe out completely for 3 to 5 seconds. Hold breath out. Close your mouth tightly around the mouthpiece for the closed mouth technique. Simultaneously, press down on the canister and inhale slowly over 3 to 5 seconds. If possible, hold breath for 10 seconds to allow the medication to reach deep into the lungs. Exhale through nose. If you have a second puff to do, wait 30 to 60 seconds between puffs. For the open mouth technique, hold the inhaler 1 to 2 inches away from your mouth. Simultaneously push down on the canister and breathe in slowly over 3 to 5 seconds. If using an inhaled corticosteroid, such as Flovent HFA, Q-Var, Alvesco, Aerobid, or Asthmacort, be sure to rinse your mouth after use to avoid oral side effects such as cough or fungal infection. For inhalers without dose counters such as this one, you must record the number of doses used to know when your inhaler is empty. As you can see, this one has 200 actuations, or you can use it 200 times before the drug is gone. So you can count down from 200 with each dose. For instance, on the first dose, you'll probably use 2 of those, so you can write 198. For inhalers with dose counters, it actually tells you on the side the number of doses remaining. For instance, this one has 118 doses remaining. The following listed products are all metered dose inhalers and have the same instructions for use. Some have the dose counter and some do not. A spacer such as this one is often used with a metered dose inhaler to improve drug delivery. It works by allowing the discharge of the drug into a chamber where particles of medication are held in suspension for 10 to 30 seconds. A spacer reduces deposition of the drug into the mouth and throat, decreasing oral side effects such as cough and fungal infection of the mouth. A spacer such as this one is often used with a metered dose inhaler to improve drug delivery. It works by allowing the discharge of the drug into a chamber where particles of medication are held in suspension for 10 to 30 seconds. A spacer reduces deposition of the drug into the mouth and throat, decreasing oral side effects such as cough and fungal infection of the mouth. Now we're going to show you how to use a spacer with your metered dose inhaler. First, remove the cap from both of the items. Next, attach the inhaler to the end of the device. Breathe out completely for 3 to 5 seconds and close mouth around the mouthpiece. Press down on the canister and inhale slowly over 3 to 5 seconds. This does not need to be simultaneous, and you may wait up to 5 seconds before inhaling. If possible, hold breath for 5 seconds, 10 seconds. If possible, hold breath for 10 seconds. To clean your spacer, rinse it under running water and then set to the side to air dry. Another asthma device your doctor may want you to use is a peak flow meter. This is a device that measures airflow or peak expiratory flow. It can be used to determine the severity of your asthma, to detect worsening lung function or asthma flare-ups, and to monitor your response to treatment for both acute episodes and chronic asthma. After establishing your personal best with your doctor, this is how you use the peak flow meter. For example, if your personal best is 400 liters per minute, you can calculate the different zones, possibly using a device like this if it comes with your peak flow meter. You move the indicator up to your personal best, 400, and then you can read the ranges for each of the zones. So in this case, the green zone, which is 80 to 100% of your personal best, is 400 to 320. The yellow zone is 320 to 200, which is 50 to 80% of your personal best. And then below 200 is the red zone, which is less than 50% of your personal best. Using these values, you can set the indicators on your peak flow meter to where they should fall. As you can see, the green matches up with 400, the yellow matches up with 320, and the red matches up with 300. To use your peak flow meter, first make sure the red indicator on the back is all the way at the bottom. Stand upright if possible and take a deep breath in. Close your lips around the mouthpiece, making sure to keep your tongue away from the mouthpiece. Blow out as hard and fast as possible. Record the first reading on a piece of paper. After repeating the peak flow meter test a total of 3 times, pick the highest of the 3 values and then record this in your chart. The patient's highest value of 310 liters per minute puts her in the yellow zone. Follow your asthma action plan determined by you and your doctor